Chapter 3, Pre-Collection Guidelines, Patient Preparation for Various Tests. At the end of this training, learners should be able to understand the prerequisites of each test so as to minimize pre-analytical errors, the current guidelines for glucose loading tests, and how to allow patient participation and support for specific tests to ensure best results. Before starting with collection of specimen, it is essential to give out clear instructions to the patient regarding the test and prepare him accordingly for the same. It is necessary to give information to the patient regarding the test because it is the patient's right to know. To ensure complete patient participation and preparation and thus best results, to make the patient understand various requirements pertaining to the test like fasting requirements, waiting requirements, and also to understand the physiological factors that can change analyte values. How to convey patient information? The laboratory has to develop its own system to ensure patient participation. What to convey? The laboratory has to develop its own processes and procedures wherever necessary using standard guidelines. How to convey patient information? By means of displays with information regarding the various tests available and also preferably in local language. By means of brochures and pamphlets with details regarding the various tests. And by means of enquiry counters which act as the communication link between the laboratory and the patient. Majority of tests do not require any specific patient preparation. However, fasting morning specimen is preferred for many of the tests performed on serum, plasma or whole blood. Several changes in values can happen due to physiological variables. Examples of physiological variations include food intake, circadian rhythms, travel, sweating, prolonged bed rest, posture, environmental factors, and seasonal influences. A few precautions are suggested to ensure best results. Some examples of physiological variability are electrolytes, serum proteins. Alteration of values can occur due to sweating. The patient should be advised to sit down till sweating subsides before sample is collected. For urea and urates, high protein intake in the diet can increase values of the urea and urates. Thus, the patient should be advised to have a balanced diet a night before to avoid error. Certain hormones show fluctuations throughout the day, which is also known as circadian rhythm. For example, thyroid hormones. It is important to inform the patient regarding tests which involve fasting. For example, for fasting plasma glucose, a fasting period of 8 to 10 hours is required. For lipid profile test, 10 to 12 hours of fasting is required. For parathyroid hormone, 12 hours fasting is required depending on the analytical requirements. Glucose loading tests include postprandial plasma glucose test and glucose tolerance test, also known as GTT. For postprandial plasma glucose estimation, adequate breakfast is to be eaten after giving collection of fasting sample. Blood specimen is collected 2 hours after food intake. If the patient is diabetic and is on medication, he or she should be instructed to take the medicines as usual. Preparation for glucose tolerance test or GTT. Perform GTT in the morning after 3 days of unrestricted diet and activity. Perform only in ambulatory subjects. 10 to 16 hours of fasting is recommended. The test should begin between 7 to 9 am. The subject should be seated in between sample collection, and smoking is to be avoided in between sample collection. For oral glucose tolerance test, two samples are taken at the following intervals. Fasting sample, then 75 grams of glucose in 300 ml of water is given to the patient. The load should be ingested within 5 minutes. The second sample is given 2 hours after the glucose load. For diagnosis of gestational diabetes mellitus, high risk pregnancy cases should be tested at the first antepartum visit and, if negative, again at 24 to 28 weeks. For others, it has to be tested at 24 to 28 weeks of gestation. For screening and diagnosis of gestational diabetes mellitus, there are two methods, the one-step strategy and the two-step strategy. The one-step strategy involves a load of 75 grams of glucose. It involves fasting for more than 8 hours followed by two post-load samples at 1 and 2 hours. In the two-step strategy, the first step is to screen with 50 grams of glucose and the sample is drawn at 1 hour. The second step, if more than 140 mg per deciliter in screening, a 100 gram load of glucose is used after fasting and followed by 3 samples at 1 hour intervals. Please refer to the current ADA guidelines. Sequential specimen collections. For some hormonal studies, specimens are collected at specific timings, example cortisol levels. The blood specimens are collected at 8 am and 4 pm. The time of blood specimen collection has clinical significance and hence must be clearly mentioned on the sample collection tube. For diagnosis of endocrine disorders, because of the episodic, circadian or biological clock and cyclical variations in the secretion of gonadotropin, a pooled sample is preferred which are drawn thrice at an interval of 20 minutes. Prolactin sample is best withdrawn 3 to 4 hours after the subject has awakened. Serial monitoring or monitoring a patient over time for specific conditions is done for various tests. For example, different tumor markers, antibody titers for follow-up of patient after treatment, for example, Vidal test, HIV and VDRL. Thus, giving out clear instructions to the patient regarding collection of specimen ensures good quality testing and thus right result.